And I'm going to turn it over right now to our director of camping, Patrick. I first met Patrick about 9 years ago. Gosh, I can't believe it's been that long. When I was just a volunteer here raising money to send kids to camp. And I thought never in a million years would I ever send my child to a camp because they could never take care of her. And they did. And it's changed her life, and it's changed my life, and it's changed my son's life. And I believe in the magic of camp. And we have a great program here for our kids, and that's what he does here. So Patrick is going to be a facilitator for us today. So Patrick, with that, I'm going to have you take it away, and Amy, you can unhighlight me and bring up Matthew.
Thanks so much, Marianne. Certainly magic is a big part of what we do. And when we think about camp, it fits into just a part of the overall experience that I think our campers and families go through. Certainly very, very excited to welcome all of you. Welcome back to those that are been with us at some point today, and welcome to those who maybe are joining for the first time. Today, we're going to talk about personalized healthcare and how to advocate for your child. I am thrilled to be able to welcome our panelists who are generously giving us time out of their days, representing at least what I think about are three important parts of I guess I look at that healthcare continuum, or that circle. Hospitals and like institutions where a lot of the work gets done. We've got primary care, kind of the individual health care that, your primary care provider. And then another really important part is kind of that health advocacy group and support organizations. And they really fill what I think are a rounded perspective of trying to help support families as they go through these experiences. So we have Dr. Matthew Dennenberg. He's the Vice President for Medical Affairs at Helen DeVos Children's Hospital in Grand Rapids. We have Dr. Becky Patrius, the Medical Director here at North Star Reach, who's also a family practice physician. And Russ Derry, he is the Director of Education for the Epilepsy Foundation of Michigan. And just before we get started, a couple reminders. We have some predetermined questions we're going to ask, but we really want to welcome yours as well. So please feel free to use the chat function to share questions you have. We'll do our best to incorporate them along the way, but certainly at the end of our conversation. And love to see smiles. Of course, we recognize that folks are in all kinds of different places, as we're still, some of us home, some kids, some office. We'd love to see your smiles, but we understand that we're all coming from those different locations. So, but also please remember to mute your microphones until later in the session when we can have some more open dialogue. So I think, let me do a really quick check. Is Matthew, are you with us?
I'm here. I'm just struggling with my video today, but I am here.
Awesome. Well, we are going to include you in this conversation, and because you're my first question, Matthew, can you tell us a little bit about what you do at Helen DeVos Children's Hospitals and how you got involved with North Star Reach?
Sure. I am the Vice President of Medical Affairs, which means I'm responsible for physician practices and clinical outcomes for the Helen DeVos Children's Hospital. And I got involved in North Star Reach partially because of my position. I was approached some years back before we actually broke ground and asked if I wanted to be involved and if the Children's Hospital wanted to sign up to be as a partner. And of course, I said yes, and I've been involved ever since then.
And we're really grateful. Thank you, Matthew. Becky, tell us a little bit about what you do at camp and back at your practice.
Hi, everybody. I'm Dr. Becky. I'm the medical director at North Star Reach, and have been involved since we had our first campers come, and have been privileged to work with an absolutely phenomenal team, and with Dr. Dennenberg and also Russ Derry, who you'll hear from soon as well. I am a primary care doc in Chelsea, which is about 20 minutes from camp, and have a longstanding interest in camp, in in play, in creating teams, in mentoring young people, and really am very grateful for being a part of our team.
Thank you, Becky. And welcome, Ross. Tell us a little bit about your work at Epilepsy Foundation of Michigan and how you got connected to North Star Reach.
Great. Well, thanks again for inviting me. I'm the Director of Education for Epilepsy Foundation of Michigan. I have been there for 21 years now, so it's been a while, and really love the work that I do to help provide educational and support services to the epilepsy community. And we were introduced to North Star Reach in like 2017 and formally partnered with you in 2018 to offer camp programming for kids with epilepsy. We were doing it for a while for many years prior to that, but we were heavily reliant on some high-level volunteers and was not really a sustainable model. And then North Star Reach came in and said, hey, we're interested in doing this for children with epilepsy. And we were like, oh, this sounds great. And it's been a fabulous partnership so far, and I have really enjoyed working with you.
Well, thank you, Russ. All right, so we're going to start with Dr. Denneberg. Matthew, if you were going to give parents guidance on how to take charge of their child's health care, what steps would you suggest they take?
So that's kind of, Patrick, it's kind of a loaded question because I'm also a pediatrician, and what I would say is parents already take charge of their children's health care. There's no question in my mind, especially parents of children with special health care needs are already in charge. I think what you're getting at is, as pediatricians and as healthcare providers, and as quite frankly the healthcare industry, we need to provide opportunity for them to navigate the difficulties and complexities of the system. And there are some states, Michigan happens to be one of them, where there should be, and not always the case, but there should be support for care managers and that kind of work. And so I think the first thing to do before you get frustrated and before you try and run the complexities yourself, talk to your pediatrician. Some pediatricians do a much better job than others. Some actually have care managers within their clinics. And I would say if you interview a new pediatrician and they don't have a care manager to help with kids with complex needs, you need to ask them why and maybe find a pediatrician that does that kind of work, because there is money available for it. There is opportunity. And I think a lot of people just don't even realize that. Now, that's not a magic bullet because it doesn't always work out that way, but there is support if you can find it. Otherwise, parents are already trying to manage this themselves. But there are care managers out there, and pediatricians are getting some money from the state and from insurance to do that. You just need to ask about it.
So I think that really is a great word. Rather than be in charge, it's navigation, which oftentimes it seems like we would wish there was GPS to do that, but there's really just a lot of interconnection and need potentially to take steps and ask questions. So when you were saying that, are those like in healthcare organizations or external to healthcare organizations, the support advocates?
It's both. Within the healthcare system, it's more common, of course, and I'm sure the parents on this call can tell you, unfortunately, once you leave the inpatient setting or the specialty clinic setting, those resources fall to the wayside. It really falls upon your primary care physician. Now, there are some health systems, DeVos does it a bit, but the wait to get into those special outpatient managers is like months long. So it's under-resourced and over-needed.
Matthew, I just want to ask one follow-up. You mentioned something there, and it's funny, it's not something I ever really thought about, but you said when you're interviewing your primary care or pediatrician, so I have this super complex kid myself, and that's not even something that ever occurred to me, that I should be interviewing her pediatrician. Is that something that is common practice in healthcare?
Oh yeah, I do not have kids with complex healthcare issues, but my wife interviewed the pediatricians before she chose one, right? She wanted, so if you're going into this with a child with complex issues, it's, what you're getting into. If you start out and you end up with a, end up having a child with complex issues, there's nothing wrong with asking your pediatrician, how are you going to help me through this? Do you have a care manager, or do you have a complex care manager? And if not, can you help me find someone that does? Or by the way, let's work together and get one, right? Because there is money out there for it. Even pediatricians don't always know that, and the ones that know that sometimes don't want to do it because it's some work. It's some work to get that set up in your office, but the good pediatrics offices are doing it. And the only reason I know that is my wife is a care manager, so I have an inside track on that.
So I'm going to ask one last follow-up about this. Sorry, because I know I've got two parents texting me about this question because they want to know more. So one of our moms that's here has said that an insurance company reached out to her and offered a care manager. Is that the same thing you're talking about?
Yes, and the reason why insurance companies are doing that because they recognize they're doing it because it's the right thing for the kids. Don't get me wrong, I'm not trying to malign insurance companies, but it also saves them a ton of money because if they can manage the complexities of care, there's less visits, there's less hospitalizations, there's less of a lot of things, and there's better care. So,
okay.
Yeah. And I'm happy to offline help get some more information for this group so we can let the other panelists, obviously jump in and share their expertise.
Okay, that's perfect.
Becky, how would you go about suggesting that parents of kids that have complex medical needs find a general practitioner for their child?
So that's a really good question. And I really like what's already been said by both Marianne and Matthew, which is you have a right, if not a responsibility, to make a pick. People feel totally comfortable picking a hairdresser, but somehow don't feel empowered to pick a physician. I'm not sure how we got ourselves in that situation, but it doesn't make a lot of sense. And you need to, my office staff is so loud right now, I'm sorry. You need to have somebody that you feel comfortable with. So just like when you go to a party, you don't feel comfortable or have an interest in talking to everybody there. You're not going to like every doctor. You need to find somebody you like. A good place to start is if you've got a subspecialist you're already working with, you can ask what pediatricians, what generalists they respect, they feel comfortable working with, because that team has got to work together. It's easier for most teams to work together if they're in the same healthcare system. Things are changing, so we're getting to the point that physicians, both specialists and primary care docs in different healthcare systems have an easier time interacting. For instance, I get up every morning, and most of you know at 5, and look at my patients' notes in 3 different healthcare systems, the ones that are within a 30-mile radius of me. And that's easy to do. It wasn't 5 years ago. So you want a pediatrician that you're comfortable with, a pediatrician that's respected by your subspecialists, and someone who's got the resources and the experience. Not, doctor, we're just people. Not every pediatrician or internist or med peds individual feels comfortable with kids that are presenting with complex medical needs. Some pediatricians really want to spend all day talking about, breastfeeding or, doing sports physicals. There is nothing wrong with that. That's probably not who we're looking for here. But doctors are not one size fits all. So you need to find somebody who just, when you talk with them, they know about your child's illnesses, they know about your child's medical problems, they have the resources that they need. Ideally, they have some relationship with a subspecialist that you're working with. It has an office that you can get to, that has an office that is accessible. You can get an appointment when you need to be seen. You have a right to expect that from your primary care provider, even during a pandemic. I guess those would be the main things that I would say.
So what things do you find helpful, Becky, when you're working with a kid that has complex medical needs as a general practitioner? How do you find the balance between kind of the everyday care and focusing also on whatever that complex need is?
The more that parents tell their physician, the better care you'll get. We have a saying in medicine that probably is true in other professions as well, garbage in and garbage out. In other words, if I don't get a good history, I'm not going to make a good diagnosis. So when you go to any physician or healthcare provider you're dealing with, it's a story. You know, we need to understand, what is it like for you at home? What do you think your kid needs? What things are you concerned about? The better story that you can give us, the better we're going to be able to work with you. And that means a lot of things. It means understanding your, you know, it feels a little weird talking to this group because I know a lot of the names here, and I think they could give this talk. In fact, in my office and a couple of patients I saw earlier today are either older kids with complex medical needs, parents of kids with complex medical needs. And, you know, they went on a rant. They could give this talk without any problem. The gist of it is plan what you want to say, keep asking questions, tell the story, tell your healthcare provider what you think your kid needs. Some little caveats that I would say that are just kind of common sense, but I think particularly in this time of a pandemic, bear repeating. You know, it's interesting. I'm old enough. I came into medicine during the AIDS pandemic, if you are epidemic, and now we're in the midst of, you know, coronavirus, and both time periods are marked by fear, by healthcare shortages, by physician and nurse burnout. And you are going in to talk to people who have been right now fighting a pandemic. And, you know, they may be worn out. Physicians, as much as we try to approach every patient and open every door with an open mind and an open heart and a willingness to listen, we can get defensive, we can get misguided, and we need your help to stay out of that spot. So thinking about what you want to say, writing down your questions is always a good idea. Never feel embarrassed about that. Speak clearly, take your time. If it feels rushed, that's probably a good indication to find another physician's office. Take your time and speak clearly, make eye contact, be kind. Your physician needs kindness too. Be respectful. I sometimes have patients who come in and speak poorly of another physician. That never helps. If you get your physician or your receptionist or your medical assistant kind of in a defensive position, you're not going to get your needs met and your kids' needs met. So just good communication skills and just good kindness, realizing that, you know, nothing fancy happened when we all went to medical school. Like, we are still plain old everyday people, just like you guys, and need your help. Yes, we've got an education. Yes, we've got experience. Yes, we've got a love for and an interest to be of service in the medical fields, but we really rely on you to help us understand what's important and what's needed.
Awesome. Well, I would encourage folks, if they haven't or if they're able to turn on the chat function right now, because there is some really great stuff being shared in regards to some questions. So don't be afraid to take a look over there and use that. Russ, I want to bring you into the conversation. What role does organizations like the Epilepsy Foundation play in supporting families? I mean, I know there's all about research and advocacy, but how do you support the people themselves?
A variety of things. You know, we speaking of epilepsy in particular, we can kind of think of seizures as the tip of the iceberg, and certainly we deal a lot with that, and we kind of see ourselves as supporting clinicians in that regard, helping families better understand how they can better manage their condition, making sure that they're getting the appropriate level of care, making sure that they're aware of all of their treatment options. So we absolutely deal with that component. We're certainly never trying to take the place of physicians. We're always using that caveat. Be sure to talk with your neurologist or your primary care physician about this. But we also can deal with all of the other aspects that can come along with a chronic health condition. So in the case of epilepsy, for example, that can include school issues, challenges getting the appropriate supports you need in school, with schools providing appropriate seizure first aid and special education services if necessary. We deal with the psychosocial impacts of epilepsy, which can be an isolating condition, with accessing mental health care, with the cognitive impact of epilepsy. In older teens, dealing with transportation barriers and how do you get around if you're not able to drive, because there's restrictions on driving with seizures. So all of those other elements of managing a complex health condition, we're there to support with that. And that can be through our helpline. So anyone who wants to contact us will spend as much time as needed to talk about how to better manage their epilepsy. We'll do individual advocacy services. And again, this is true across many organizations similar to ours. Those advocacy services to kind of intervene when there's a conflict between perhaps a school and a family, to try and come up with a mutually satisfactory resolution to that conflict. We do awareness trainings in the schools and other areas, just so that to help reduce stigma associated with epilepsy. Obviously, support groups are very common in organizations like ours. There's really no substitute for being able to connect with other parents and learn from their expertise. We don't have to do much at the support groups. We just kind of sit back, occasionally, some discussion prompts, but for the most part, the parents are the experts, and that ability to just learn from each other what works, what doesn't. Speaking of trying to find a pediatrician or try to find a subspecialist, a lot of times that's a great starting point, is to ask others who they've tried. Have they had a good experience or not? We do educational conferences much like this, monthly conference calls. We have self-management programs focused on depression. We have one for teens. So again, a lot of organizations like ours are offering this similar array of services that can help not only with managing the condition itself, but with all of the other impacts that condition can have.
Awesome. Thanks for kind of helping to tie in that broader picture and know that there's other resources. I think that's, at least in what I continue to learn, is that resources are so valuable and important. And I think that some folks, at least I have to imagine, when they get that diagnosis, don't even know where to start, and they're overwhelmed. Sometimes certainly there are the immediacy needs, right? Like you get a diagnosis, whether it's at an emergency room or whether from your physician, and that sense of, I need to do something now, but I don't even know what to do. And knowing that you have resources out there has to be super, super important. Matthew, I want to come back to you and ask a question. So, Becky was talking about sometimes there's not a good fit, and finding another a primary care physician in a larger institution. I'm sure communication, especially when you're dealing with different departments, different physicians, different resources. If parents are frustrated and feel like they're not being listened to, what's the best way to kind of navigate that world within a larger institution?
So this is a tough one. This is, it's easy for me to say on my side of it, and I'm not, on the other side of it very often, that it's just good communication skills. And it's something that we would want you to do if you were having a miscommunication or disagreement or a misunderstanding with a family member or a friend or a shopkeeper or anybody. But I'm also not naive to suggest that healthcare is not different, right? We know that parents and patients in general are often afraid or concerned or worried about confronting their physician if there's because that's the person that's responsible for taking care of your child and writing prescriptions and God forbid doing surgery on your child, right? So the last thing you want to do is create friction there. But I think it's very important if you have a provider or a physician or an APP or someone that's taking care of your child that's afraid of or insulted by or embarrassed by you bringing up your concerns, then it's probably not a good fit to begin with. So that open dialogue, raising your concerns and being able to have a respectful conversation is important. And hopefully your physician, so half the times the physicians don't even know you were concerned. They just assumed everything was okay. So I think open dialogue is important at first. And I'm not suggesting it's easy, but I think it's important. And then if you can't get the resources and the services and the things that you think you need, continue to advocate with your physician, and you may have to switch physicians, even a different physician within the practice, right? It's an important relationship that's going to be fostered over years to come. No one says you have to go with the first doc that you think you picked that you liked, right? We change relationships all the time.
And are there do social workers or psychologists, patient navigators, are those all resources you can use as well?
All of the above, and they can actually help intervene between, if you think you're having a miscommunication with the physician. Again, I'd say 80% of the time, if your physician knew that you were confused or you weren't understanding or you didn't like what they were saying, they don't even know it. And I think a lot of physicians would like to know that, and I think it opens up the communication. But yeah, all those other resources are really important. The patient navigator is critical. That's that care manager I was talking about.
So, Becky, what resources do you feel that are underutilized for complex cases and complex kids?
I may not be the best person to answer this question. The short answer is all of them. I mean, it's so interesting. Amy and I were privileged to be in a parent support group, and the parents that we met with every other week for several months were really experienced parents who have dealt with, like, on an expert level with kids with a variety of complex medical needs. And one thing that I was really surprised by week after week is resources that one or the other of the parents didn't know about. I mean, heartbreaking stories of, sleeping in your car and not, knowing where to get a meal and transportation. And, the number of resources that are out there is amazing. Another group that I'm privileged to belong to is the Palliative Care organizations in Michigan, and they have a tremendous number of resources that I think are underutilized. I put some stuff in the chat box too that may be helpful. I think if you said, Patrick, you can only say one thing, like I only get one sentence to answer that question, it would be ask other parents. Like, they are the true experts. It's kind of funny to me that, no offense, Matthew and Russ, but we're posed as the experts because we're in positions where experience, we, certainly have something to say on these things, but I think the real experts are our parents. And then if you said, okay, well, if I can't talk to them, who? Then it would be social workers, nurse navigators, child life, like, these are the feet on the ground people who really know, the resources that are available and how to hook you up with them. And then organizations such as the Epilepsy Foundation, like, whatever chronic disease conditions your child has, I can guarantee you there are organizations whose passion is to be of service to you. So you just need to find them and go to those people.
Anything you want to add to that, Matthew?
Yeah, I would add, it's, again, and Becky and I are probably thinking the same thing. It's easy to say, just go find them. And the finding them is the hard part. And again, that's where I agree with Becky. It's unbelievable the amount of information that can be gleaned nowadays from these family groups, from social media and these family groups. Again, caution to the people that are using those groups. Make sure it's a group of people you trust. Social media has real, and I don't have to tell the parents this. The parents know this better than I do. The social groups around this have been phenomenal. I am always I want to be careful of the information that people are sharing, but family groups are amazing. But I would say, you need to advocate for, and it's not even called a care manager, it's a care coordinator, which is what they are. They help know these resources. I think that professionally, that's where I would go. But again, I agree with Becky. Talk to other parents. You know, it's amazing the resources that are out there that even I don't know about, right? We don't know about in healthcare. I'd like to hear from the parents because really they are the experts.
Well, I want to say that my biggest experience, and I'm still struggling with this, and you touched on this, Dr. Becky, and I'm part of one of the parent support group with North Star Reach, but I've been having the hardest time finding a doctor for Zoe, just a primary care physician, because a lot of times they'll take her on, and then when we go to that initial appointment, you can just see it in their face, like, oh no. Like, what? No. And so what I get a lot of times is, I'm going to refer you here, I'm going to refer you there. And then those doctors are like, well, your primary should be handling this, but my primary is kind of nervous or scared. At least that's what it seems like. So finding a medically complex home is a lot harder. I've noticed, and I'm in Chicago, it's the major city, right? But that does not mean that every, like she's a patient with Lurie's and they're the best hospital, but I haven't been able to get a medically complex primary care physician. So it's kind of all over the place. And if you don't have that component, every other component is just kind of haywire because everybody wants to communicate through the primary. And the primary is like, oh no, I don't know anything about this. Talk to your pulmonologist, and the pulmonologist is like, well, I sent it to the primary. It becomes a cycle of frustration. And I have 3 care coordinators, but I'm not sure what they're supposed to do. They're not coordinating very well. So it's just trying to find that place is major.
Just so you know, if you look at the Children's Hospital Association, the AAP, and you name the professional organization out there for pediatrics, there's 3 things that are on the list of priorities that are broken in this country. Number 1, unfortunately, is always right now for the last half a decade or decade has been mental health. Number 2 is complex care. You just reiterated, primary care physicians struggle with feeling they have the expertise. They feel they don't have the time. They feel they don't have the resources. And so it's one of those challenges that doesn't have a good solution. And I that's why in the hospitals like DeVos that have developed a complex care program, the wait list is 3 to 6 months long because there's 150 kids waiting to get in.
So true. Because we are on some of those waiting lists.
I for some reason I can't see. Is that Cece talking?
Yeah.
Okay. Yeah. Cece,
Yes, and it's because I'm driving.
We've talked about this before, and I'm hoping that's something we can work on, being good facilitators for finding, just at least finding ideas or references. Because every once in a while you find a gem that'll deal with one of our complex kids, but Faith is 15 and has had 7 pediatricians in her lifetime. So that should tell you something. It isn't easy with the complex kids.
If I can say one other thing too, internists and, probably a rare family practice doc, med peds people may be a resource to you too. The age that they start, that adult quote unquote doctors start seeing kids at varies. In our practice, it's 12. So you may find, as your kids get into their teenage years, that an internist may be more comfortable with more complex conditions, and it's an additional pool of resources. At least we're short primary care docs, and CC, you're absolutely right. Like you need the center for the spokes on the wheel. You can have really solid subspecialty spokes, but need that center.
Yeah.
Russ, I'm curious from a support organization's perspective. Do you hear these kind of things coming to you, to others? And what do you do when those challenges are shared with you?
I think, again, navigation is one of the biggest challenges, finding the appropriate resources. ultimately we have to remind parents that, you know, they have to be advocates. They have to be strong advocates, and that you know, as much as you would like there to be good co-management and care coordination between subspecialists and the pediatricians, they do their best, but it doesn't always happen. So the parent often has to be driving that and making sure that they're communicating and sharing their notes on treatment decisions and overall management of the primary condition and overall health. And so that, you know, a lot of parents have a big 3-ring binder that, or it might be an app for tracking or managing symptoms or that sort of, or managing or tracking medication changes and that sort of thing. Whether it's an app or a binder, having that information all in one place and making sure you're sharing that with all of your entire healthcare team is really important. And then again, connecting with other resources out there that that might help. You know, one that is, speaking of underutilized, I think one that may a lot of parents may not be aware of is Children's Special Healthcare Services, and in particular the Family Center for Children with Special Healthcare Needs, which can help connect or help people or parents navigate these complex systems, and also again provide support for that specialty care that's not covered by insurance. So that's, you know, one resource in the school setting. Michigan Alliance for Families is another really great organization that is made up of it's by parents for parents, with parent mentors, and they can help again with special education services and getting appropriate supports in the school setting. So yeah, again, it's a lot to navigate, and we try to assist with that in any way that we can. But to reiterate, you know, connecting with those other parents to find out how they manage is probably the most valuable thing.
Seems like it can be incredibly overwhelming. What, I don't know if advice is the right word or recommendations, but, and even from some of our other parents here, you know, again, that mountain can seem so gigantic. What's some wisdom to potentially share around how to find a pathway through that, you know, forest between the trees, right? Like, it just seems like it's so thick. How do you get through that experience? Is there any recommendations or advice out there?
Yeah, I mean, I think breaking it down into manageable steps, of course, you know, when it seems overwhelming, and giving yourself credit for small accomplishments. You know, you don't have to figure everything out at once. If you're able to make a little step forward in the management of your child's condition, celebrate that. And you know, the other important thing, you know, every year we do something called our Challenge of the Year, where we identify some major epilepsy related problem that we're not able to solve, but we want to try and move the needle on at least a little bit. This year, we identified supporting caregivers as our Challenge of the Year. So just realizing how important it is for caregivers to tend to their own health and engage in those self-care practices is so important, because obviously you can't provide the best care for your child if you're not in good health yourself, and that means physical and mental health. So finding time to devote to yourself and to get the support that you need, whether it be just time to read a book or time to relax, time to enjoy a hobby, or respite care, which unfortunately is that's one of those things that's lacking in our state. And hopefully, you know, through some new priorities on the horizon, maybe we'll start to see more support for things like respite care and other caregiver supports. But Yeah, I mean, I think just, prioritizing your own health as a caregiver is so important.
Yeah, you're certainly echoing some conversations that have been had throughout the day about that self-care for parents. And I know that that's got to be really difficult, right? As a parent, you want to put your kids first, but it's trying to figure out how to take that step and make that choice to provide that self-care. So one of the things that certainly has become more prevalent over the last year and a half has become telemedicine. And I'm curious for Matthew or Becky, how have you seen telemedicine work or not work for complex medical needs for children, and any recommendations or things that you've learned through that experience?
So I would make two recommendations. One is, and as somebody who's been doing medicine for 25 years, I would say keep an open mind. It's very easy to immediately say, how could virtual care work for me if I can't be in the office and have my child examined or face to face? And I think we're learning, especially in behavioral health, as an example, that a lot of times virtual health is actually better in a lot of ways. And I think that, especially with parents who maybe need 3, 4, 5 specialty visits in a day, or even 2 or 3, it might actually be an answer, because they don't have to leave the house. Now, I'm not saying that everything can be done virtually, but that connection with a provider, that connection with a care coordinator, that connection with the office can certainly be virtual, especially for the older kids. So I would also push your primary care provider and your specialists. Again, do you provide telehealth? Do you provide virtual visits? And if not, why not? Right? Because most specialists of any high caliber and most children's hospitals are providing that now, not just because of the pandemic, because it saves you, packing up all your stuff and your child and coming down to the hospital and navigating our crazy parking lots. And you can get 2 or 3 or 4 of your specialty visits done in 2 hours at home and never leave your house. Now, don't get me wrong, there are times you're going to have to come in, but I think a lot of what we do actually could be done virtually and coordinated much better, right? So I push for it, but I also know it's got its limits. But the limits, we haven't even come close to pushing the limits yet.
Right. We've been involved with the Michigan Pediatric Epilepsy Project, and telemedicine was one of the primary focus areas of that project. And prior to the pandemic, we were doing quality improvement initiatives with specialty care and pediatricians to try and improve and increase the use of telemedicine. And it was slow going. We were not getting very far, in large part due to insurance coverage barriers. But then the pandemic came around, and now suddenly it was much easier for people to access that. And so that's kind of one of the silver linings that hopefully that came out of the pandemic, is that it showed us just how valuable telemedicine can be. And hopefully, again, insurance companies will recognize that and will help to provide that appropriate coverage for that, because particularly in a large state like Michigan that has a lot of rural and remote areas, and with subspecialty care being somewhat limited to mostly Southeast Michigan and Grand Rapids area for epilepsy, at least, that just provides such easier access to that care, because it's not only the time you're at the appointment, it's the travel time, it's the having to take your kid out of school, all of that. It just adds to that investment in having to get to that appointment. So we are all very much in favor of anything we can do to expand the use of telemedicine.
Awesome, thank you. Well, I know there's a couple questions that kind of popped up, and I wanted to, as we near the end of this time with this group, I wanted to take advantage of opening up the floor a little bit to see if any parents had comments to share or had other questions that they wanted to ask of our awesome panelists. Cece, I noticed you said app suggestions. Can you tell me more about that?
Yes. So Russ was saying that there are apps where you can manage the medicine changes or appointment. I was just saying any apps that people may use. I'm open to suggestions because I'm just using old pen and paper, and it could probably be done a lot easier moving to technology. Guess I should take advantage of the fact that we are in 2021.
Pens and
Well,
papers feel comfortable sometimes, though.
I think still some people just find the old 3-ring binder approach more effective.
Yeah.
But yeah, so whatever you're comfortable with. I know with epilepsy, there's my seizure diary, there's seizure tracker, there's a whole host of apps, and you can look at the ratings that they get and look at the features and find out does this do what I want it to do? And they apps may not meet all of your needs, so it still may be a combination of an app that we use specifically for medications or for seizure tracking, but we still have a binder or notebook or something where we are tracking other aspects of the condition. So it's very personalized, but I think if you go to any app store, there's a pretty huge proliferation of apps that relate to chronic health, chronic disease management.
So I know the American Academy of Pediatrics suggested, it's called MedSafe, I think. I got it here on my phone. I think it's just called MedSafe. It's just medication management, and when Faith was on TPN, it popped up when I'd have to take her glucose levels, and it's super helpful. I think it manages all medications. So try MedSafe.
Thank you.
Any other questions that are out there? I know there's a conversation earlier. I think Kelly, you had chimed in talking about utilizing insurance companies as resources.
Yeah, so I know that some of the, and obviously I have to give the caveat that I'm in Ohio, so I'm not exactly sure what the Michigan Medicaid systems are doing. But in the state of Ohio, there's going to be some changes moving forward. For example, our hospital is going to essentially be buying out a portion of the Medicaid patient population. And so we are going to be sort of creating a children's health insurance company with the goal of having better care management, so that by keeping our kids on track with vaccinations and well visits and these things, the hope is that they spend less time getting sick and therefore less money. And so Ohio is really sort of changing the way and encouraging the hospital systems to do this. I know that Nationwide Children's has a new big care management program where they've, from patients that follow here, that are on their health insurance coverage plan, we've had care managers reach out to us. So if that's something that your insurance plan offers, I would definitely, take advantage of that. Ask them what services they can help you with. Can they help with scheduling appointments? Can they help with getting information between providers? Can they help with access, if you need transportation or any financial help, ask them what they can do. And then I think I put in the chat, and Dr. Becky also mentioned it, but I'm a huge advocate for asking about palliative care. So in the adult world, we think of palliative care as death and dying, and that is absolutely not what pediatric palliative care is. It certainly does provide support, for end of life care and hospice care, but they do a whole lot for family support and sibling support and financial support and being a go-between, between subspecialists. And so if you're at a pediatric facility and you feel like you can't find a care manager and you can't find a pediatrician that's comfortable maybe ask one of your providers, if they would be able to refer you to palliative care, because I know that our palliative care team has a lot more resources for care management than any of the subspecialists or pediatricians. So that's a really, really good resource to reach out to. So maybe kind of keep that in your back pocket as well.
So that brings me to a question, just from the standpoint of, if I wanted to, because we've had palliative care before, but it was very hard to get. I'm in Chicago, so in Illinois, I don't know what is the norm, but Zoe had surgeries, and she just was screaming all the time, so she was in pain, and I kept going to the doctor and going to the doctor, and then eventually, I think it was a child life person who just happened to be in the room, was like, well, why don't you guys tell her about palliative care? It sounds like she could, use that service. And if she hadn't mentioned it, I wouldn't have known what it was. But even when she did, the doctors was like, well, no, she doesn't need this. So when you bring it up, and I guess this is more of a question maybe for Dr. Becky, how do you get the doctor to provide said information? Like, because I've had situations where I've asked about things and didn't necessarily get, a response that would have been helpful.
Becky, let me grab that for 30 seconds. Let me just answer that real quick. One of the things that we have to do is we have to do a much better job as pediatricians about teaching fellow pediatricians what palliative care is. A lot of pediatricians are still stuck. If you say the word palliative care, they think you're talking about hospice, and they don't know the difference. And palliative care, you can have patients can qualify and could benefit from palliative care from the age of 1 day to the age of 110. And we just, as a profession, have done a terrible job of teaching people about palliative care. And so I suspect that there are pediatricians out there that when you recommend palliative care, their brain thinks hospice, and it's totally different. And so that's the first thing we need to do, is recognize what it is and then describe it. There's a really, really good kind of fun or well done cartoon video about palliative care. Patrick, if you remind me, I'll find it and send it to you, and we can share it with this group.
You bet.
Thank you.
Becky, did you have any thoughts?
Yeah, I just, I agree with what Matthew and also Kelly were saying. And I would just go back to what I was saying before, which is doctors are just human too. So if you say it in a way like, some of my friends have told me that palliative care has been helpful. They're in similar situations. I'd really like a referral for that. Would you be willing to do that for me?
Okay, thank you. I think it is probably a combo of how I asked, and just maybe if the doctor wasn't sure and might have thought hospice care, it was probably like, no, she doesn't need hospice care. So that wording it differently does change, maybe what they thought I was asking.
And, we don't know everything. Like, you could go to them and say, hey, I was on this, conference call and learned something about palliative care. I'd really love to try that. Like, prompt us along so we don't look like idiots and you're more likely to get what you want.
Well, I know we're coming to the end of our hour, and want to really appreciate all of you in the audience, for our participants, for sharing comments in the app or in the chat room, and also your comments here. Wanted to leave just a minute to each of our panelists to kind of share any closing thoughts that you might have before we close things out for day one here at CARE Conference. Russ, do you have anything you want to kind of sum up with?
Just to reiterate what everyone has said before, it's a journey, and it's seek support wherever you can get it, whether it's from other parents, from other organizations, or from your healthcare team. One other thing I wanted to mention that a lot of parents may not be aware of is the idea of healthcare transition, and that thinking ahead to, okay, that transition to adult care, that's, you know, supposed to be starting around the age of 12. And I think parents may assume that, you know, you don't deal with that until you're 18 or 17, but that's a slow, long process that should be taking place with your pediatrician and your subspecialty care, doing things like transition readiness assessments to see if your child is to what degree they're starting to manage their own condition, to what degree they understand what medications they're taking, what they're, all of those other things about their condition. That's just something to keep in mind, if that hasn't been a conversation you've had with your medical team and your child is 12 or older, to kind of start that conversation. But again, thank you for inviting me, and keep always remain hopeful too. That's the other thing. It's a lot of great research that's going on out there. So
Thank you, Russ. Dr. Becky?
That was an important point. Thanks, Russ, for saying that. I just want to say, we may not say it as healthcare providers, whether we're your subspecialist, your ER doc, your primary care doc, but we are in awe of you. We know when we get in bed at night, you know, we ask ourselves, could we do this if we were called to do the work that you're doing? We have tremendous respect for every parent who brings a child into us. And please forgive us for not always saying it. You are the experts. You are the ones who know what your child needs. Yes, we have some expertise, but boy, thank you for the work that you're doing. Every healthcare provider that you come to is in awe of you, even though we may not say it. And just a reminder, take care of yourselves. You know, it's like they say on the airplane, if you got to put your oxygen on first, you know, you've got to have something to give to be able to give. So you are your child's most important resource. Treat yourself with the sacredness that you deserve.
I think Matthew's technology quit on him, so we'll kind of wrap things up. Thank you, Russ, for coming and spending some time with us. Dr. Becky, as always, thanks for sharing your wisdom and your heart. Matthew Denenberg, thanks for taking time out of your busy day at the hospital. Thanks so much for being a part of Care Conference Day 1. I know we're going to kind of close things up here in just a moment. But really wanted to appreciate each and every one of you for being a part of this experience here with our panel, and also being a part of our day today.